As we put 2021 behind us, many of us were hoping to do the same with COVID-19. However, here we are, in the midst of yet another dreaded surge, thanks to the Omicron variant. The latest spike in cases comes just as our kids are home from school on holiday break, families are getting together to celebrate, and in-person events return to our community. These gatherings typically draw large groups from all ages and walks of life, making the risk of spreading the virus even more concerning. In an attempt to get a sense of what we are seeing here in Wellington, I sat down for a virtual meeting with Dr. Larry Bush, Infectious Disease Specialist at the Wellington Regional Medical Center. According to Dr. Bush, hospitalization numbers are up throughout the county.
Maybe not severe illness, meaning intensive care unit admissions and mechanical ventilators, but definitely hospitalizations. A lot of the hospitals have gone from a low of maybe 1 or 2 or 3 up into the 10, 20, 30, 40 range.
Between December 16th and December 22nd, Palm Beach County saw a 167% increase in COVID cases and 68% increase in hospitalizations. In the last 7 days, the county's positivity rate has increased to 14%, which is a 9% increase from the prior 7 days. As Dr. Bush tells us, this time around, they're seeing more and more younger patients testing positive.
The greatest increase right now are in younger folks for a lot of reasons. They're less likely to be vaccinated and more likely to be out and about without masks and things like that. So when you put those two together and you have a more transmissible virus, you had the perfect storm.
While the severity of symptoms and the death rate continues to remain low, doctors and health experts agree that we must stay vigilant during this surge.
When people say, well, it's not very virulent and it's not affecting people's illness that much, just by sheer numbers, the hospitalization has to go up. Even if it's not a greater percentage of people who get infected require a hospital, the fact that you have more people getting infected is just a sheer number. And that's what's happening across all age groups. A lot of the hospitals have gone from a low of maybe 1 or 2 or 3 up into the 10, 20, 30, 40 range.
While vaccines remain our most effective line of defense against COVID and all its variants, it's important to remember that we must continue taking proper actions such as wearing masks, distancing appropriately, and avoiding large gatherings.
So we have a very transmissible virus here, which causes mild disease, meaning people can be spreading it before they know they're even ill. So we need to get back to masking. And how do I say, if I'm in a room with people who I don't know who've been fully vaccinated and apparently are not ill, I still will wear a mask. I just think it's the safest thing to do.
The way things are going, the new year will start the same way it did on January 1st, 2021, with all of us fighting the COVID-19 pandemic. Research from the Emerging Pathogen Institute at the University of Florida shows that the Omicron is expected to replace the Delta as the dominant variant by early January of 2022. Dr. Bush explains what this means for our future.
I don't think this is going away. Right now, 4 coronaviruses cause 1/3 of the common colds every year. This may be the 5th. And if that's the case, that would be a victory. We could live with that. And I think that's what we're going to have here. I think we're going to have other variants, like we have other colds, like we have other flus, but it will be a less severe disease. That's likely what's going to happen with COVID.
As many people return to work from holiday gatherings, the highly contagious Omicron variant will continue to surge and is expected to get worse in the days and weeks ahead. Despite the alarming numbers we're seeing, Dr. Bush is cautiously optimistic that we will see a slowdown in the near future if we all take advantage of the tools we have at our disposal, specifically vaccines and boosters.
It will slow down again like Delta for several reasons. One, there'll be more natural immunity from disease, knowingly or unknowingly. Remember that there's probably another 40% of numbers who have not been diagnosed because they never went and got tested or because they had mild to asymptomatic disease. It is estimated that 30% of the country has been infected knowingly or not. So it's not the 51 million cases we hear about, it's probably more like 110 million cases. So as that spreads, there'll be more people becoming immune, which means less chance to spread it, even though you still can spread it. And because I think people are going to start to get vaccines who haven't, vaccinate their children who haven't, and get boosters. A booster's not a negative thing. It's not saying, well, look, they were wrong about the vaccine or they lied to me about the vaccine. You get a pneumococcal vaccine booster. You get a tetanus booster. You get a pertussis whooping cough booster. This is good. This is not bad. It's not nefarious. So as we encourage more vaccinations and as disease spreads naturally, the numbers will drop. All pandemics have done that. This will not be any different. The problem is the carnage that has to happen until that occurs. And we could change that because we have tools that you didn't have in 1918 with the Spanish flu.
And while we're on the subject of preventive actions, it's important to remember that masks work, and wearing them is one of the most simple things we can do to keep our community healthy.
Well, masking works. There are studies of journals that show you various studies where masking definitely decreases transmission. Because remember, the purpose of the mask is that if I have COVID and my face is covered, those respiratory droplets, which will fall down before they get inhaled by somebody else rapidly, get greatly diminished if I put something in front of me.
During our conversation, I asked Dr. Bush about monoclonal antibody therapy and Regeneron treatment, specifically about their efficacy and availability in Palm Beach County.
The Regeneron has run out. There's short supply right now, so there's a bigger demand and a shorter supply. Number two, it appears to be not very effective, if effective at all, against Omicron. So most hospitals, because they don't have any, and the little bit that they do have, they find it not to be very helpful to tie up the hospital doing that, have abandoned using Regeneron. Having said that, in the state and county centers where the monoclonal antibodies are being given, they're still using Regeneron because frankly, you don't really know if the patient has Delta or if they have Omicron. Now, the latest monoclonal called sotrovimab is effective against Omicron. The hospitals don't have that because that was in short supply and is being diverted to the monoclonal antibody centers.
Dr. Bush is hopeful that we'll be hitting a critical point in treatment and prevention very soon. While it is difficult to predict an exact course and impact of this variant, Dr. Bush tells us that we are close to what he calls the grand win.
What I have said over the past few days is that we're almost at reaching what I call the trifecta, the grand win here, which is available effective vaccines. And we have that. So what we're waiting for is we're waiting for the other two pieces of that trilogy. We're waiting for rapid testing at home, and we're waiting for the Pfizer drug to be readily available throughout the state, the country, and the county.
Visit wellingtonfl.gov/coronavirus for information on testing locations, including Wellington's curative testing site at Town Center, as well as other county sites. I urge you to continue to heed advice from local health experts like Dr. Larry Bush and his team at Wellington Regional Medical Center.
And it really comes down to what's our goal, saving the most lives or saving the most way of how we live, the most of our lifestyle. And to do both of those, we just have to do common sense things, and this will come to an end. There's two ways this is going to come to an end. It will be infection throughout the world and a lot of people will die, or we can control it and mitigate that. It just takes an effort, and you have to trust somebody. I wouldn't be saying this stuff if I didn't believe it. And I know this will make a difference. It will come to an end one way or another, but you can make it less severe. You can bring back our lifestyle more rapidly so we can all go about doing our thing and to stop the havoc that's going on here. And along with the havoc is a lot of, upset just in society, emotional issues, political issues, financial issues. We can control that better than we ever could for any pandemic in the history of the world. It's up to us.
While some of the things we talked about today are eye-opening and alarming, none of this should stop us from celebrating the holidays with those we love. Let this be a reminder to celebrate safely. We have the power to end this pandemic by being vaccinated and wearing our masks. It's that simple.